Good afternoon. My name is Laura Pannell, and I want to introduce, we have two guests with us today who are both with Lifecore Health Group, and they're going to be talking about the mental health services that are available in our region in northern Mississippi. And first, I want to introduce Tina Hooker. Tina is the director of the Tupelo Crisis Stabilization Unit. She previously worked with individuals with IDD, which you probably remember or recall. Those are individuals with developmental disabilities for 11 years before coming to Lifecore in 2015. She works and has worked as an outpatient therapist before actually running the outpatient clinic in Pontotoc. In July of 2018, she became the director of the Crisis Stabilization Unit here in Tupelo. She provides ASIST and MANT.
Yeah, ASIST is a suicidal almost workshop to train individuals what to do when they think someone's maybe thinking of suicide, and how to gives a framework how to work through that.
Good. What about the MANT?
MANT is a training to help de-escalate and how to do relationship as well as a physical skills when someone's aggressive or becoming agitated, to keep it from escalating, help things to de-escalate.
Interestingly enough, Tina also became certified to actually train law enforcement officers in a crisis intervention training program that is currently happening here in Lee County with the Sheriff's Department as well as the Tupelo City Police. She has her master's in counselor education. She's had licensure as professional counselor in the state of Mississippi since 2004. She is a graduate of Blue Mountain College.
Well, that's correct.
Brandon Tudor is a nationally certified counselor. He is provisionally certified addiction therapist and a certified grief counselor. He is the alcohol and drug therapist for Lifecore's PACT program. You're going to hear a lot of acronyms and names, and one of our goals today is to walk you through these different programs so that you'll have a better understanding. He earned his bachelor's degree in educational psychology from Mississippi State in 2015, obtained his master's degree in clinical mental health counseling also from state in 2018. So we are delighted to have Tina and Brandon here today to talk about services. What you are seeing on your screen, you will notice that you will have access to Department of Mental Health website, and we may toggle back and forth, but we also have the Lifecore Health Group. And so I'm going to turn the program now over to Tina and Brandon and let them share with you some information about the services available in our area.
Okay. Well, I trust this will be helpful, and we'll be able to say something that will help you as a in your, not just in your studies, but as you progress in whatever the Lord leads you in. As far as Lifecore Health Group, we are your local mental health regional facility. Used to be called Region 3. We have an array of services. We want to focus today on mostly on crisis and people struggling with severe mental illness. But just for a short sort of synopsis of Lifecore, we're in the school system with support therapists to provide individual therapy for children. We do outpatient therapy. We provide medical care. One thing we've learned about mental illness is they often do not follow up with physical care, which plays on people who have severe mental illness often have physical issues that compound their mental illness, and they just fight against each other. So anyway, all that is important. We as far as the crisis stabilization unit, we work closely with the state and the commitment process. Let me, don't tell I'm organized.
That's okay.
All right.
You're fine.
What we do specifically at the Crisis Stabilization Unit, we're there to help people with acute psychiatric issues, people who are a threat to them or harm to themselves or others. They or it could be just a sudden emotional pressure, something that's happened environmentally or situational that has caused, in some cases it can be as much as a breakup where someone don't want to live anymore. So we serve individuals in this type of capacity. As far as them coming in, anybody can refer to us. We've had people show up at the door and tell us, hey, I'm struggling with this. And first thing we do is provide assessment and walk through that process. If they meet the criteria, and we will take them in. A general stay for us, more so with people with mental illness, is anywhere from 3 to 10 days, depending. I guess I struggle because I have several people in my mind that's there currently who have been there for several weeks, but are in a situation that they're extremely mentally ill, have no family support, and are unable to live on their own. So that puts, we can't turn them to the street, and we don't want to. So that's a huge situation and a huge problem across the state with all the crisis centers. We take referrals, like I said, from the community, from it can be from the doctors, ERs, from the individual ERs, our local mental health facilities call us. And what we do, one of the other things we want to say is about the commitment process. Those are volunteer individuals who choose to come on their own. Now, commitment process is where someone needs help, but is not in a situation to choose help for themselves, and where it can be a family member, a friend, just a concerned local citizen that recognizes that a person needs help. They go file what they call a writ. And each county is different, and each county does it different. Most counties go through the circuit clerk to file this writ. You go, you give them the information, what you know, and then they will follow up with some investigation. They'll have someone to go do a pre-eval on that individual, and then there'll be 2 doctors that end up having to see that individual and agree that yes, this person needs to have some type of commitment. And there's 2 types of commitments. There's one that is specific to drug and alcohol, and then there's one specific to mental illness. And it makes a huge difference on which one you do, depending on where the person's at. And with the commitment process, what they'll do is they will send, once all that's been signed off on, they will send the information to the state hospital. We have one here locally, right down the hill from us. Matter of fact, here in Tupelo, many people have heard of Whitfield. That's another one of the state mental health hospitals. And anyway, what happens is often the state hospital, especially down the hill, they will call us. If they usually have a list of people or a waiting list, they'll say, hey, we have 3 people on the waiting list. Can you take any of these? And so we can take referrals from the Chancery clerk or the state hospital. We have had the Chancery in different counties call us, say, hey, we have this individual, a writ has been filed. Can you take them? Because one thing they don't need to be is in jail, even though if they are a harm to themselves, they will pick them up, but that's really the last place they need to be. But just because of this situation and the potential for harm, either to themselves or to others, they will pick them up and hold them until they can get them in a place that is more that's more adequate, where they begin to get care. So that's how we work with the state hospital, and we have we have gotten individuals that have been committed, and we've been able to get them stabilized and back into the community without going to the state hospital. That is the goal, to keep as many people, as far as us, keep as many people as possible out of the state hospital and out of the jail. The more we can do of that, we're reaching our goal. So that's what we pursue and desire to do.
Tina, you mentioned earlier, you talked specifically about people who have alcohol and drug substance use issues, and you also talked a little bit about people who have mental health disorders.
Yes.
We know the term comorbidity,
Mm-hmm.
and could you expand on that just for a moment and talk a little bit about your experience with comorbidity among the clients that you serve?
Well, when we're looking at comorbidity, we're looking at pretty much dual diagnosis. That's where someone comes in with a drug, alcohol, some type of diagnosis, along with some type of mental health diagnosis. And most of the time, one of the first things we do in our assessment is we drug test We drug test the individual, and if and it's rare that we get someone who doesn't test positive for something, but often in situations, people are self-medicating. Now, there are diagnoses that, we have people who have been struggling with a diagnosis of schizophrenia for years, but we also, especially the more you see the harder drugs, one of the huge things, bath salts, meth, where it just wreaks havoc on a person's brain. And we see people who just don't come back from that. And it's so scary. But here now we're dealing with a mental illness, but sometimes that's brought on by the extensive drug use. And it is scary. So if any of y'all are playing with it, don't. If you know somebody playing with it, warn them. So go ahead.
And one thing I'll say too is that the last time I spoke to one of Dr. Pound's classes, I had talked a little bit about my caseload, and just gave a rough estimate of about a percentage of people that I thought on my caseload had comorbid diagnoses. And so after that class, I got a little bit more interested, and I was like, you know what? I think that number is actually a lot higher than I probably quoted in class. And I started looking, and it 100% is. So I started looking, and I gave a rough estimate of 80 to 90%. And what I really should have said is probably 90+% of my caseload. And if you take a look at the Program of Assertive Community Treatment, which is PACT, the program that I work for, the caseload combined is about 67 clients now. So we're pushing 70. And out of those 70, there are probably at least 58 to 60 that have a dual diagnosis, if not even more than that. And so you're looking at 90%. And so when we talk about comorbidity, yes, generally we do think, and one of the main definitions of that is to have a substance-induced disorder or substance use disorder combined with a mental health disorder. But very often you see people who have major depression that coexists with anxiety. You often have bipolar disorder, 1 or 2, that coexist with personality disorders, things like that. And so not necessarily just a substance use disorder combined with another one, but at the same time, you can look at a wide array of mental health disorders and typically pretty much pick out ones that go together very often. So when a client comes to me and they have bipolar 1, I'm automatically on my radar going to be watching them and monitoring them over the next several sessions to see if I can identify some personality traits that maybe qualify for be diagnostic criteria and meet that criteria, because I know that the comorbidity is so high for some of those things. So.
Well, while we're talking, Tina's talking specifically about the crisis stabilization units, and that has kind of led Brandon talking a little bit about the PACT program. How do those programs work together?
Brandon, won't you share a little bit about the PACT program and then how we...
Yeah.
Okay. And so, like I said a couple of minutes ago, PACT stands for Program of Assertive Community Treatment. And basically, some admission criteria. I think Dr. Pound's going to pull up the website here for you. And some admission criteria for PACT. The main thing we look at is if the person has been in and out and in and out and in and out over and over again of inpatient psychiatric hospitalizations. And so you think about North Mississippi, I'm just talking here in Tupelo, North Mississippi Medical Center Behavioral Health, North Mississippi State Hospital, a commitment to the crisis center. I know Corinth has a crisis center. So inpatient mental health facilities is what we're looking for at PACT. And if a client, that's one of the main things that sticks out to us. Is because if you're in and out constantly, let's say, I have a client that's probably every 3 months, she ends up going inpatient, meaning at a crisis center, at state hospital, behavioral health, wherever it may be. And so that's one of the main criteria to enter the PACT program. And that's just because obviously if you're in and out and in and out of these hospitals, well, something's not working, right? And so let's try something different at this point. And so when a person comes into the PACT program, our ultimate goal of PACT, and I don't know if this website is updated completely or not, it's going to tell you a little bit about it here, but the ultimate goal is for independent living, to reduce the number of psychiatric hospitalizations, but to also keep people sustained in their community and in their homes and still get psychiatric services in their home. So if you've ever heard of the least restrictive environment, that's where we want a person, because we want you to thrive in that environment. And if you're cycling in and out of hospitals, the person is taking up a bed, and they're going to go through a perfect example of this is people who go in and out of rehab. They do a 30-day, and as soon as they get out of rehab, they're going back to meth or back to marijuana or back to cocaine. And so, 3 months later, 6 months later, a year later, they've hit rock bottom again, and they're back in rehab, and they've done this 10 times over the last 2 years, maybe. And so this is typically people that we're looking at when we're talking about PACT clients, okay? And so PACT has the ability to go into people's homes, provide individual therapy, to manage their medications. So we have the ability to have a medical doctor go out. We have the ability for the therapist to go out, the case managers to go out. And case managers, if you are a little bit unfamiliar what they do, they can take clients to pay bills. They can take them to other medical appointments. They can take them grocery shopping. If you needed like the electric bill paid. Sometimes it may just be socializing, just getting out and going out to lunch, depending on where the client's at and what the need may be. So PACT consists of clinical mental health therapists. We have 3 of those, myself being one of them. We have a PACT team leader who's also a therapist, but our supervisor as well. And then we have another therapist. So consisting of 3 therapists total. We have 2 case managers. We have 2 registered nurses. We have a psychiatric mental health nurse practitioner. We have 2 peer support specialists, something called a peer bridger. And what she does is really cool. She's able to go to the North Mississippi State Hospital, behavioral health, other places, and kind of link resources in between. And she kind of goes and attends in all of those meetings and make sure that we know what we need to know and they know what they need to know about us and vice versa. And so that's where a lot of referrals can come from and really working in the community. And so one thing that I do enjoy about PACT is that several clients have mentioned to me before, Brandon, I've been so depressed that I've been in my bed for a week. I haven't showered in a week. I haven't brushed my teeth. I haven't washed my hair. I haven't taken any of my medicine. I've eaten 2 meals over the last 7 days. And I can, with the PACT program, I can look at them and say, okay, what's your address? Me and so-and-so are going to come out and we're going to do an assessment. We're going to get you back on medications. I'm going to bring the psychiatric nurse practitioner out with me. We're going to do an individual therapy session while you're laying in your bed if you want to, wherever it may be. So PACT is truly, when we say meet the client where they're at, we mean that very literally. And we throw that around a lot, but PACT has the ability to do things like that. And so the beauty in that is that my job is not sitting in an office, always face to face with the client, chair across from chair. It can be, I've taken clients to the park before or walk around the mall, and as long as they're okay with having psychotherapy in public, then that's fine, as long as they agree to that. We do something on Mondays as far as animal therapy goes. I know some of you have talked about or been interested in animal therapy, equine therapy, whatever it may be. And so there are actually a place in Tupelo here, if you've heard of the Tupelo Lee Humane Society. So back last year, I was able to reach out to the director there, and they're actually closed on Mondays. And but I met with her, and she was gracious enough to open specifically to the LifeCore PACT program on Mondays from 10 o'clock to 11:30. And so I take my clients in there and they help. For some of them, they would rather just volunteer, and that's okay, just to spend time with the animals and to help. And that's okay, because we know that helping helps relieve some depression symptoms. When you help others, you feel good. Okay, and so sometimes they'll clean out cages and they'll feed or water the animals, whatever it may be. But some want to get more personal, and so this is when we talk about animal assisted therapy. And so the majority of my clients will grab a cat out of the cage, or grab a dog out of the cage, or grab one of the bigger dogs from the back and take a walk, or if it's a smaller animal, and we'll go to a bonding room. And what that means is that we'll go to the back, and it will be me in the session, the therapist, the client, and then a cat or a dog. And they'll hold the dog or cat, they'll play with the dog or cat, they'll feed treats, and they'll do whatever. And it puts them in a place and in a mindset to be comfortable. And a lot of times I have found that clients will sometimes tell me, for them, they won't necessarily say this is a good thing, but they will tell me more sometimes than they want me to know, because they're so comfortable being around a pet, and it relieves anxiety to a level of where you're able to sit and you're able to talk about your feelings and talk through things and process things. And it's been so helpful for some of my clients who experience trauma and have PTSD diagnosis, because they're able to come in and are able to say, like I have one client who was beaten in the head with a baseball bat, and for her to relive that experience is, as you can imagine, extremely difficult. But when I take her to animal therapy and she gets a dog, and she's a calm dog, I might say, and able to sit there and play with him or her, and feel the animal, pet the animal, talk about maybe, for a lot of people, the animals are there because they've been abused, because they've been neglected. And so they can relate to that in some way. And so that's some things that we bring out. And then we bring out, how comfortable are you on a scale from 1 to 10, having having therapy, individual therapy with an animal, rather than me just sitting and feeling like you need to make eye contact with me in a session without the animal, or whatever it may be. And so I could go on, and the list can go on and on about how helpful animal therapy is. But the overall goal here is just to say that about animal therapy, in general is that it helps decrease that anxiety and some depression symptoms that people would otherwise experience, sometimes even in a session. And so it's huge.
You know, one of the things that's interesting, I think, about what Brandon's sharing with you and what Tina will share with you in a few moments when she talks about the mobile crisis response teams, is that, you know, these individuals are very innovative. They are, you know, willing to look at different ways of trying to reach those clients where they are.
Mm-hmm.
And as Brandon said, you know, that's one of the keys to the success of this program, is to try to help these individuals and ultimately to allow them to continue to function and remain in the community where they live. And one of the things that the PAC program does is they also help people who don't have a place to live.
Mm-hmm.
They can work with them to actually try. There's a number of programs, and we don't have time to get into a lot of that today, but they do have some programs where they can work with those clients to help them bridge that gap to find a place where they can stay independently. And at the end of this today, I'm going to talk about a couple of volunteer opportunities for you and or your family, your church group, your Sunday school class, you know, people that you know who might be interested in helping with some of these programs. So we'll talk about that at the very end. So Tina, you had mentioned something about the mobile crisis teams, and then I think you were going to address a couple of other things.
Well, one thing before Brandon started, we made mention on how we work together, and so just based on what he said, you can tell that at once we release someone, if they are meet the criteria for the PAC team. And one thing about this PAC team, it only services this particular PAC team, Lee County or within the Lee area. So
hopefully that will grow at some point.
Yes, that is a huge need. But anyway, huge referral for us, and we know that individual's followed. So one thing I really want to bring out is a service that LifeCorps provides, and there is a service throughout all of state of Mississippi, but for our region, this service is called Mobile Crisis. It's called MCIRT, Mobile Crisis Response Team. Anyway, I don't know. Yes, that's where it is on the internet. What the Mobile Crisis Response Team does is, it is a number that you can call. It's made up of therapists, master's level therapists, or there are, I think maybe there's some peer support specialists on there, as well as community support specialists. But it's a number anyone can call that is within a crisis, or a friend of someone that, you know, just needs help and they don't know what to do. They can call this number. Someone's at that number 24/7. They actually have a couple of phones, like if it's not answered, there's another phone out there that call should roll over to. So that's day or night, any time of the week or weekend. But I'm gonna throw that number out. You can find it if you wish to go on the Department of Mental Health's website and look at services, and then you can go all the way to the bottom on services at crisis services, and that if you'll scroll down to mobile crisis, you show the regions, and we're region 3. But it will give each region's number. I had someone call me from Jacksonville, Florida, one night, and I thought, well, I really don't know. So, but if you can get them on the phone, I'll be glad to talk to them. But anyway, the number is, just in case, 1-866-255-9986. And one thing we do is hand out magnets that sticks on a refrigerator. And if you ever think you need a magnet, or a friend needs a magnet, just talk to your Miss Laura here, and we'll
Mhm.
we'll get you one.
That's right.
Because when you're in a crisis, you can't think.
Mhm.
And so that's why that's important to have that
Yeah.
number there. But what happens is that person will be on the other end of that phone, and also they will be mobile. They will come to a person if needed. Now, if it's a crisis situation and it's in question about any danger, something we have not mentioned yet is a crisis intervention trained officer, CIT officer, which Lee County, the city of Tupelo, some in Itawamba, and it's catching on. It's a national wide recognized data driven training for officers, specifically for officers, how to go on a call and deal with individuals with mental health issues, and how to respond in those situations, because you're not dealing with people who are rational, and they think different. So it just gives them another tool in their tool belt, and how to work that situation. And what I find hugely interesting is it's called the Memphis model, and it comes out of Memphis, Tennessee. I think it was birthed maybe in the 90s, late 90s, where a young man was eventually died from multiple gunshot wounds. But it was, they were dealing with that situation, and but out of that's where this Memphis model came from, and it's known really worldwide. So we're excited about it, and we are set up where an officer, unless someone is under arrest, they cannot put them in their vehicle and transport them. But if a CIT officer is able to assess a situation, and if they recognize that this person needs mental health assistance, they can put them in their vehicle. And because we're set up as a single point of entry, trust me, I did not know what single point of entry meant when they first told me, oh, we're going to be a single point of entry. But anyway, they can bring them directly to us and pass them off to us, and we can begin to work with that individual. So what a huge service to our region, and we're excited about it.
And if you know people in law enforcement where you live, and you live outside of Lee County, please encourage that chief of police or that sheriff to contact the Lee County sheriff or the City of Tupelo Police Department about learning more about this training program specifically for law enforcement officers, because it is a fantastic program, and it can be, the training is 40 hours for the officer, but it is a wonderful model to help these officers to be able to go into a situation, assess it, and de-escalate a situation. What you see on your screen right now, I kind of switched over. We were talking about the mobile crisis response teams, and you'll see they're listed by region and then the phone numbers.
And that's on the Department of Mental Health website.
That's right, Department of Mental Health. If you go down and you actually click right here, it says identify your region, you'll see that for a lot of us, Region 3, which is Benton, Chickasaw, Itawamba, Lee, Monroe, Pontotoc, and Union. However, if you go over, you'll see that some of you may live in Alcorn, DeSoto, Prentiss, Tippah County, Tishomingo, Clay County. So what you'll do is you would go in here and select the region that is where the county where you are located, or the individual you're trying to help is located. Sometimes we'll receive a call from one town, but the person they're trying to help is in another county. So
that's right. And each region has their own mobile crisis team set up. That's done statewide. And so you'll find those numbers. The number I gave out was just specifically to Region 3, but you can find those on the website.
And that's not just for professionals, that's for people that in the community.
That's
Anyone,
right.
anyone can call that number
Absolutely.
Yes.
for assistance in a crisis situation or guidance
Yes.
regarding someone that they
If
fear
your
may be
7-year-old is able to dial, he's and they in a crisis, they're welcome to call that number.
And there's a couple of more things that I want to plug right here while we're talking about ways to get help. But I think we would be doing you a great disservice if we didn't give you all the resources that we had and ways to actually reach help. But reach a licensed therapist any day of the week. You know, it's very unlikely that you're going to find a clinical therapist if it's, you know, midnight on Christmas Eve, right? So one number I want to give to you specifically for crisis, but also suicide hotline. So this is the National Suicide Hotline. And if you have a pen and paper, I'd encourage you to write it down, and I would encourage you as well to keep it as a contact stored in your phone, because you never know when you're going to need it. I've used it several times, okay? And so that number is 800-273-8255. That's 800-273-8255. And so, yeah, so it's on the bottom of the page. Here's the Suicide Prevention Lifeline. And there are other numbers too, like if you click on the bottom of the page here that you can see, there's Shatter the Silence, that's for domestic violence. And so there are other hotlines, and really it's just a quick Google search to find the different numbers to something more specific. And one other thing is you can actually, because you're a resident of Mississippi, now other states may be different, but the Department of Mental Health in the state of Mississippi has set up a program where you're able to text, and you text the word HOME, HOME, to the number 741-741, and you can text with a licensed therapist anytime, 24/7. It works just like the suicide hotline. It has been extremely useful for the adolescents that I have seen in the past because they can't talk to their parents. They don't want to tell their parents that they need to see a therapist, or they think the school counselor doesn't care, doesn't listen, or doesn't provide psychotherapy. You know, a lot of times you'll hear a lot of my adolescents will say, and I don't see adolescents at PACT, but often I will see families, and so adolescents in those families PACT. Just to clarify, PACT is for 18 and older. But when I was doing practicum and internship, I often saw teenagers, and it was so helpful for them because they were like, we can really just text someone about our feelings that we don't know, and any time of the day, any time of the night. You know, because I had a kid that I was talking to last week, and he's 17, and he was talking about, you know, I know you were asleep at like 3 a.m., so I couldn't text you. And so I didn't want to, I was having an argument with my parents. And so I was able to text this number and kind of talk it out through text at 3 a.m. one morning when he was in crisis. And so it hadn't gotten to a point of where he was suicidal, but he was deeply emotional and needed to talk right then. And so that's helpful for anyone. But
so Brandon, that just to clarify, you said that was for the state of Mississippi. So when those individuals text that 741-741 and text home, they're going to probably or always be talking to a licensed therapist from Mississippi.
yes,
So this is going to be somebody in Mississippi that they're going to be talking to.
yes, from the Department of Mental
Okay,
Health.
so this is like a national thing. This
No.
is state of Mississippi
This is-
Department of Mental Health.
Absolutely, and that's something the Department of Mental Health provides. I don't know how recent it is. I just heard about it through a conference from the Department of Mental Health just earlier this year, and thought it was the coolest thing.
It
So I
is.
shared it with everyone because, you know, a lot of people, you know, text is one of the main ways we communicate these days, and so to
Even in the
have it
same
there-
room.
Yes.
yeah,
Sitting
And
at the
so-
same table.
right. And so and I always think about clients in domestic violence too.
Mhm.
So if a husband is beating on his wife, or vice versa, a wife is beating on her husband, and you know that person doesn't want to make a phone call in front of them, or can't make a private phone call. Sometimes if they have their phone, they can text, and you know you can text and say, hey, I'm in a crisis, I need help, or can I just talk through some things, I'm going through some domestic violence issues. And so it's been extremely helpful. But
I'll put that out on inside inside the course so that you guys will know what, get that number out.
Yeah,
so you can
and
put it down.
it'll be a licensed therapist anytime, and it'll be a licensed therapist in Mississippi. So,
That's fantastic.
All right. One of the things I thought about that I think it's important to share here. We've talked about, crisis services, several things, but what about cost? Everything. Oh, what do I do? How much is this going to cost me? One thing we do operate on is grant, and we have grant funds, and everything that we've discussed or focused on is grant funded. And so, for instance, the CSU, it's operated on a grant. We do not, you don't have to have funds to be there. So that's really not an issue. PACT, they operate on a grant. The mobile crisis unit, it's operated on a grant. There's no bill coming to someone. It's a service that is there for you or a friend or whoever who might be in a crisis situation that needs help immediately.
We've been talking quite a bit. About some of the crisis services, those kinds of things. Could you guys expand just very briefly, because I know our time is limited, just for 3 or 4 minutes, about services that are available in our community for children and adolescents?
Sure.
Reaching out for that.
Okay. As far as children and adolescents, we in each of the schools, Life Corps has placed a support therapist, and that's what they call them. They work in the school. They do not work for the school. They are a Life Corps employee. Everything's confidential. If you need access to that Life Corps individual, you can actually call Life Corps, or you can call the office and ask them to speak to the Life Corps individual. And so there's 2 accesses to that. We also have doctors that just see children for medication, as far as any type of medication that may be needed, and you can have you can do therapy and not have to have medication. Medication in my world, I don't think medication is a fix-all. Therapy is healing.
I think most of us would
Therapy
agree.
is healing, but sometimes, like for a headache, sometimes you can add medication as you go through this process, but it rarely ever is a fix-all.
And we don't want it to be first priority, but
Yes.
in a lot of cases, especially when you're dealing with psychotic disorders,
Exactly.
it is one of the first things that we're going to have to go to, and that's because we have to have the person calm enough and in a state where they're not hallucinating, where they're not extremely delusional, to be able for psychotherapy to be effective. And so in certain cases, medication is a first go-to. But for certain disorders, major depression, generalized anxiety, if we can work through it with psychotherapy, and this is for kids and adults, of course, we want that to be the first option. We never want to over-medicate.
Yes.
Yes.
Does that answer?
Yeah, I think that does. I just wanted to make sure that we were briefly kind of mentioning that there are services specifically available for children
Yes.
and adolescents. The State Department of Mental Health operates a adolescent center in Meridian,
Yes.
specifically for adolescents.
Yes. Now there's also, you have Parkwood, Alliance,
Some
private hospitals that if a child or adolescent needs to go inpatient, that are available.
And there are certain private practices as well too, but that's going to be a little bit different when you're talking about the cost effectiveness, because private practices are usually going to be something that we therapists like to say self-pay, just meaning that most likely you're going to pay out of your pocket. Now, most private practices will accept insurance too, but then there's going to be a copay or whatever it may be. And so usually within a state-run or government-run system, that's not the case. So when you start looking at private practices and things like that, then you are going to look at a bit of a different price change and financial requirement for those. But
Yeah.
as far as state-run and government-run, usually kind of set up, yes, with grants and billing insurance, things like that. So.
And I will speak just very quickly to the older adult population, because that is a specific population. And there are several behavioral units that are designed specifically for older adults. There's one in Houston called Trace Pathways. There's one in Boonville. There are several out there in the community. Pontotoc has just started, interestingly enough, a day program,
Yes.
which is wonderful. Yeah, that is a great program from North Mississippi Health Services. It's in Pontotoc, but the great thing about that is it's a day program, and they can actually provide transportation if it's within a certain number of miles of their facility in Pontotoc, and they provide meals and snacks and therapy and other kinds of support for those individuals. And so there are a lot of programs out there for older adults that are specific to them. And, as we kind of wind this up, I want to make sure that I say to you that if you have questions about this, you can always, message me, your instructor, and your instructor can put you in contact with some information or some people who can answer or give you more information if you have questions.
Yeah,
Absolutely.
I think one of the things we haven't mentioned that one of the services, which is a huge issue, is that we have a chemical dependency service. We call it CDS, but it's inpatient. They do 30, 60, 90 days, depending on where the person is. And depending on what the drug of choice is and what the individual dealing with, there's certain grants to cover certain things. Of course, we've all heard of the opioid epidemic, so there's several grant funds out there for that. But anyway, I did want to throw that out there, and as well as they do intensive outpatient therapy with that as well.
And just for, I know we're out of time here, but just for a brief moment, because Dr. Panel mentioned individuals that are part of the older population, and she may have already shared this with you before, but when you're talking about individuals that are older or elderly, we're talking like 65 and older, it's common to sometimes the main misconception here is that depression is normal with their age, and that is very far from the truth. And so I would encourage you to, if you have grandparents, great-grandparents, older parents, whoever it may be in your life, older friends, to monitor them closely in some ways if you see signs of depression, because that is not normal of the aging process. Maybe occasional sadness, and because they are facing their own mortality, they know that end of life stage is coming or happening, and so but that does not mean depression that is diagnosable is normal for them. And so that's when it's time to reach out for help and make them aware of that, because if they constantly hear that, oh, well, it's just you're sad because you're getting older and depression is normal for your age because you're getting older, you're all right, let me know if you need anything, that's sometimes a typical way that we handle that. And so and that shouldn't be the case for them, because that's not a normal occurrence. So
good. One of the things that Brandon has brought today, and he can briefly mention to you, is something that I'm going to scan and make available to you as a PDF document. Brandon, do you want to mention briefly what you have brought for us?
Yeah, so this is basically just a handout. it's making Tupelo a better place. So a lot of these are, yes, specific to Tupelo, but some of these have versions of these facilities or these programs in your area. And so on the front page, you'll see where it lists places to find housing, to find food. And these are, it basically is just a resource guide, because people will often come to us with who have just completely hit rock bottom, whether it be because of something, domestic violence, because of drug abuse, the drug use, and whether it be just their mental health symptoms. And so when we talk about that, it's important for them to know their resources and to know what's out there, because there are resources out there for pretty much everything. You just have to find them, or find the people who have them and get them from them. And so on the front page, you'll see places that set up for free food. The Salvation Army is listed on here for housing, safe for victims of domestic violence. Saints Brew is a church here in Tupelo that provides homeless and low-income residents a hot breakfast Monday through Friday, 7 to 8:30 a.m. And so a lot of our clients refer to these places, and it even goes on the second page. You'll see where it talks about where to get free medication and see a doctor for free. One of these is the Tree of Life Clinic, Catch for Kids Clinic, the Good Samaritan Free Clinic, and all of these are here in Tupelo. But I would encourage you, if you're from the New Albany, Ripley, Tippah, Tishomingo area, wherever it may be, to figure out where some of these resources might be similar in your area, because yes, this is specific to Tupelo, but I wanted to bring this because it's an excellent example of where to refer people when they come to you and say, I haven't had a meal in 3 or 4 days. Okay, well, I'm a therapist, I don't really do that, how can I help you? And you need to have those resources on hand when someone says that to you, because it's important not to kind of leave them in the dark on issues like that, because if you can help them find resources for housing and help them find resources for food, your practice is going to be more successful and more therapeutic. So,
and churches certainly are a great source of those kinds of programs, and certainly they have a lot of information. The other place that you could reach out if you're looking for more information is to your local United Way, because many of these agencies are funded through United Way. And even things like Meals on Wheels, which is for older adults. So there are a lot of agencies that are assisted through United Way, and even some of them that aren't, that United Ways very often will have information and can assist you in accessing more information about those services. One of the things that I want to mention to you just very briefly has to do with volunteer opportunities, and how you or your family or Sunday school class or whoever might be interested in helping. I am on the advisory board for North Mississippi State Hospital, which Tina mentioned very early in our conversation, which is the inpatient facility here in Tupelo, serving all of northern Mississippi. We have an organization within North State Hospital called Friends of North Mississippi State Hospital. And the entire purpose of the existence of that group and that program is to provide funds to help individuals who are there, patients who are there with things that they may need that Medicaid or the state cannot pay for. And some examples of that would be a bus ticket. You may have someone who's about to be discharged and they have family in Jackson, Tennessee. And so this group will pay for a bus ticket. They also, we purchase Bibles and have Bibles through the Gideons, but also other sources to have reading materials. We buy reading glasses for people. There's lots of things like that, even clothing. You can't imagine what a blanket, their own personal blanket that they can call their own, means to someone.
Absolutely.
In these kinds of situations. So if you're interested in those kinds of things, you can certainly reach out to me, or you can reach out, just call the number from North Mississippi State Hospital and ask about their Friends program. and they can give you more information. I do also want to mention to you that the PAC program and their outreach and trying to help their clients become living independent in the community when some of them, start with nothing. They do appreciate donations.
Absolutely.
What are the kinds of donations that would be beneficial, Brandon, to the PAC program? Yeah, I know. It's furniture. Strangely enough, furniture, household items,
I mean,
kitchen stuff, clothing, even.
I mean, honestly, these are just human beings, and they need everything that you need. So think, toiletry items, clothes that you want to get rid of. Yes.
Soap, shampoo.
A lot of them are getting a home or an apartment for the very first time in several years. So they're needing pots and pans and paper towels and non-perishable items that they can use to make a few meals every now and then until they get on their feet, or until food stamp goes through, or whatever it may be. And so really, we're up for donations for pretty much anything. And so anything that you might need around your house, these people need as well.
Yeah, and the PAC number is on the website and the information I've given you, but you certainly can contact me, and I'll be happy to put you in contact with them. But I do know that, very often, if you have a heart for this, if you have a heart for people who do have mental illness and mental disorders, mental health issues, then this, these people are often very forgotten. And there's unfortunately a terrible stigma in our society about people, the whole concept of having a mental health disorder. And so what we want to stress to you is that there are great services out there, but there are also ways that you can be involved if you have a heart for this and you want to help.
Absolutely.
Yes, no doubt.
Dr. Pennell, thank you so much for having us. I've been thoroughly enjoyed it.
Well, we have this is kind of the end of our session, and we so appreciate Brandon and Tina giving them their time and their expertise to sort of walk us through some of these services and some of the things that they see in their own practice, helping individuals in our community. So if you have any questions, again, we'll give you links on the website. We're going to give you some information. So please reach out or ask myself or the instructor if you have questions in that area. Anything else?
No, I'm good.
All right. Well, guys, thank you so much. We appreciate your being here. And we will go ahead and make all of that information available within the course. So you'll actually be able to see it and download it or go to those websites with information inside the class itself.